Hey, good morning, everybody. We should get started. A couple of minutes past 11. My name is Peter McGrath. I'm the coordinator of an organization called the InterAcademy Partnership. I'll introduce it briefly in a second. I'm presenting this session alongside Montira Pongsiri from Save the Children. We're going to be talking essentially about the contents of this book that you are the first to see. There'll be copies, as you can see, to take away later. And we'll tell a little bit of the story in the opening of how we arrived at this book. But the essence is this book contains case studies of how different countries, different cities even around the world, mostly developing countries the case studies come from, are tackling this nexus of climate change and health. Next slide. Okay, we've introduced ourselves, our contacts are there. You'll find them also on the last slide as we finish up. The InterAcademy Partnership is a global network of academies of science, medicine, and engineering. We have 150 members, and we calculate that amongst those 150 academies, there are something like 30,000 elected scientists. These are the top scientists in those countries, so the people that we can call on to engage with our work, which is often at this science policy interface. We have two secretariat offices. I'm based in Trieste, Italy. We have other colleagues based at the US National Academy in the USA. We also work through 4 regional networks: ASA for Asia, NASAC for Africa, ISAC in Europe, and YANAS for the Americas. Partnered in this project with Save the Children, so I'll hand over to Montira for this.
Hey, Peter. Hello, everybody. Children is a global leader in humanitarian and development programming. We work with partners in the private sector, governments, civil society, and in Save the Children's work addressing the health impacts of climate change are really, really critical, because climate adaptation planning, climate mitigation planning by countries cannot ignore health. Ignoring health would undermine our well-intentioned efforts to improve health. So what we do is to work with communities, with governments, decision makers, to really co-design and implement interventions, while at the same time strengthening the evidence base to inform the types of interventions that work in context. So we're very interested in preventing, with reducing and managing the health risks of climate change. Next slide, please. Under current Paris Agreement country commitments, a child born in 2020 will experience twice as many wildfires, 2.8 times more droughts, 2.8 times more floods, 2.8 times more crop failures, and 6.8 times more heat waves compared to a child born in 1960. These health impacts are, the data show, are most born, the worst impacts are most borne by children living in low and middle income countries. And the impacts will be greater for children living through conflict, and those experiencing inequality and discrimination on the basis of gender and displacement, among other factors. Next slide, please. Climate change is among the greatest threats to child survival. And this is because climate change disrupts and damages the functions of our natural systems, such as our oceans, our lands, and forests. And in turn, this affects the provision of food, our safe water, our clean air. So climate change also exacerbates the already existing socially needed risks of displacement and access to essential services. These are some of the health impacts of health risks of climate change, and they happen through many, many different pathways. You'll hear more about those in case studies presented today. Next slide, please. Climate change presents creates inequities in the present and for future generations. Next slide, please. So so let's say the children have operationalized a multi-sectoral systems-based approach to addressing climate, health, and equity together. These are some of the strategies that we take, and some of the strategies you'll hear in today's talks and in the book collection itself, case studies. So what we're trying to do is understand better the impacts and interconnections between human activities, climate and health, and the social determinants of health. Trying to foster community action to identify, test, and evaluate interventions. To break through decision-making silos, we're using integrated data and decision support tools to facilitate multi-sectoral governance. That I mean share information and coordinate policies so that they're not working at cross purposes. And then to facilitate the participation of communities in the co-design and co-implementation of actions. We're strengthening community skills and leadership to participate that actively. To increase finance for climate action, for climate and health, we're advocating the public and private sectors. Next slide, please. Next. I want to mention one last thing, which is that Save the Children became the first child-focused NGO to be accredited to the Green Climate Fund. And this is important because the Green Climate Fund has not to date focused and funded health-focused projects, climate and health together. So this year we're working with the government of Laos, WHO Laos, to strengthen climate, the health system to be more climate resilient. So this is one of many more projects we hope will come on climate and health, followed by other organizations in other countries. Next week, I'd like to Peter.
Okay, so how did we get to where we are today? Our collaboration. IAP itself started on this idea of climate change and health back in 2019. I mentioned earlier our 4 regional networks. We challenged them in 2019. You go back to Asia, you go to Africa, you go to the Americas, the others in Europe, and each of them produced a report of what climate change and health means for their particular continent. These 4 regional studies were then sort of brought together in a global synthesis report, which was released in 2022. I think at that point, Save the Children also published their executive summary. You see here. So there was a meeting of minds, if you like, and that's where we started discussing what we could do together. And the idea started at the beginning of 2023 was to try and identify case studies from around the world that are tackling the issue of climate change and health from a scientific perspective, but with the idea of producing recommendations for policymakers. And that's the result is what you see here in this book. Next slide, please. So we put out an open call. We got more than 80 applications, 80 proposals of case studies. We sifted through them. We invited 15 of those authors to Trieste, where I'm based. We had a workshop, each presented their work, also in front of a sort of group of peer reviewers. 3 of those, you might recognize faces, are in the audience today. They will present their particular case studies to you. We took some of the synthesis, if you like, from those diverse 15 case studies. We presented those in a policy brief in Dubai last November. And in the meantime, we were busy editing the case studies, quite long technical documents in some cases, to more easily understood, policy-friendly, if you like, public-friendly. And that is what is present in these books now. So copies are available for you to take at the end of this session. So please help yourself. So let me introduce. I'm just the what's it? The ringmaster, if you like. The main event, or the 3 speakers that we have for you today. The order is correct. We have Carity Wright, who's sitting here from the South African Medical Research Council. We have Aduwati Sali here from the WIPNET Research Center at the University Putra Malaysia in Malaysia. And we have Cynthia Awuni from the University of Ghana, you're doing your PhD also with the Imperial College London. So one more slide. Each of them will now present their case studies, and then we'll go into a question and answer session. So I think we can stop there as of always, and I invite Carity to come up.
My name is Aduwati Sali. I'm from University Putra Malaysia. So we're going to present today a project entitled NetPeat, Network ASEAN Pit and Forest Communities for Transboundary Hazing, addressing air pollution in the ASEAN region. So if I can go straight to the problem statement. In 2019, the region embraced or had to experience this transboundary haze. It was really bad in the region. If you can see on the left, it's in Jambi. The sky was red, yeah. And in Malaysia alone, you can see the Twin Tower. KLCC Twin Tower is just a blur in the background, and also in Brunei. So from this context, we notice that this transboundary haze, one of the main factors is pit and forest fires. In the region, in the tropical region, pit and forest is vast. The majority of pit and forest in the world lies in the tropical region. So we notice that the impact of this transboundary haze, especially from the pit and forest fire, is multiple things. The first one is it is also a carbon storage. Pit and forest is not the same as any normal forest. And when we burn the pit and forest, it is like double warming. We burn the carbon storage as well as releasing CO2 to the environment. And from the health impact, it can create memory loss, high blood pressure, respiratory illness, and risk of lung cancer. If you can see here, this is from the World Economic Forum. It is a lung of a teenager, and he is a non-smoker. But the lung looks like this because of the air pollution. So we want to mitigate this. And if you can see from the economic impact, this is particularly in Malaysia, there are so many losses from the cloud seeding, cost of firefighting, decline in the first landing, as well as tourism-related activities, as well as productivity loss and cost of illness. So from these impact, we have been working together with the policymakers, especially in the region, and this one is particularly in Malaysia, with the Ministry of Energy, Science, Technology, and Environment. Yeah, and then we have developed this policy for pit and forest management. So you can see this is a Malaysian map. The pit and forest is all over the country. And it is not just in Malaysia, but the other ASEAN countries as well. So with that in mind, we've been thinking how we can help mitigate these issues. The pit and forest has been managed manually all these years, but if we can use technology, especially IoT, Internet of Things, and big data analytics to help the local community as well as the forest rangers, forestry department to better monitor the pit and forest. So we come up with a solution on IoT, which is a technology base, and we deployed it in pit and forest of interest. So this is a deployment in Malaysia. We have the ground sensors, which measure the ground sensor parameters such as groundwater level, soil humidity, soil temperature, and we also have weather station that measures the weather-related parameters. So these sensors are connected to the internet using LoRa and 4G or LTE. Then 5G is not deployed yet, so we use the available wireless networks, which is 4G. So from this technology, we replicate, this is the example of the replica that we always bring for exhibition or to explain to the public. So we replicate the technology not only in Malaysia, but also in Jambi, Indonesia, as well as in Badas, Brunei. Of course, the deployment, the framework, technology framework is the same, but we adapt it to the local needs and local requirements, especially from the deployment point of view. So from here, we monitor hotspots, and from these 3 peatland forests of interest. And we have been working closely, especially with the forestry department. We've been so lucky that we deploy it in a forest reserve, which is governed by the state government, Selangor in particular, and we have close meeting with them, and they are also one of the project members in this project. And we also have restoration activity, especially when there are issues on the peatland forest. So we make sure that the forest, the peatland trees are replanted. So this particular project, we have deployed this IoT-based peatland monitoring. We can view the condition of the peatland forest in real time, especially when the data is transferred or transmitted to the cloud, and then we can view it on our dashboard. So we did not see any fire occurrence on the observed plot. Of course, this is a proof of concept on a very small, not that small. The area is chosen based on the highest possibility of fire. So we observe within that plot, and then there is no fire occurrence in the deployment of the technology. And then we use cost-effective techniques or technology, which is LoRa. We want to deploy as many sensors as possible. So we want it to be cost-effective, especially for the deployment in the area. So we find out that LoRa is one of the potential solutions. Okay, and then we have been monitoring groundwater level, and we adapt it to the peatland forest fire detection and prediction. So what we are doing now is currently we do peatland data analytics for forest fire estimation in consideration of fire danger rating system, FDRS, that has been used throughout the region, in ASEAN region. And we are, the FDRS is being developed by Canadian regulatory body. So we adapted in the region since the year 1995. Okay, so we can see here, this is the dashboard that we have from mobile phone view as well as the PC on laptop view that the forest rangers and the local community can view in real time. So what we are thinking now is how we can extend this project. So apart from the IoT system, big data analytics, so we are looking into ways to increase it in terms of visual IoT. If we can have immersive view of the area, not only just from the data, but from the, if you want to call it CCTV, a high resolution camera. And if we can also monitor the CO2 emission from the soil degradation, as well as inclusion of non-terrestrial networks such as satellite networks to better monitor a larger area of this peatland forest. So these are some of the issues that we think can be improved and can be extended from the current project. So you can view more of our work here in the promotional video. And we see that there are a lot of potentials for this project in technology base. Of course, we don't want to replace the manual data collection or manual peatland management. We still need them. We still need the local community. We still need the forest rangers to go there and validate the data. But we see there is a potential of extension, especially in terms of monitoring of CO2 emission, and then how we can help reduce the cost of forest fire. You can see here 16.1 billion in 2015 alone, and it is twice the cost of tsunami in the region. So we have made sure that, of course, when technology comes in, people will say, how much is it? This is always the question that we receive. But we are ensuring that the project or the installation of the technology is cost effective by using LoRa, and we make sure that the big data analytics done can be beneficial to the subject matter expert as well as to the local community. Okay, so we have filed we have granted 4 intellectual property and now coming up with 4 filed IPs. And if you can see here the ROI that we have managed to compare here in terms of the cost for 5 years deployment, we only need 180,000 ringgit. But the return in terms of cost effectiveness by mitigating the issues is 6 million. So the ROI is fast. Yeah. Of course, we make comparison in terms of technology of LoRa, the one that we propose here, in comparison with 5G. 5G is still needed to push the data to the internet, but for the local transmission of the ground sensors to the gateway, we use LoRa. So in a way that we can cover 2 kilometers here if you want to compare compared to 0.6 kilometers using 5G. And then from this comparison, ours is so much less. compared to the other technology. And we noticed that some issues regarding forest fire cost. So the one in 2016, there was a forest fire there. And then from the loss value is 100 million ringgit. And then there is one issue in 2022, where the company was fined by the government because of this slash and burn activities for agricultural that spreads to the peatland forest. So you see that the loss value is huge, but when we invest in terms of deployment of technology to help better manage the peatland forest, we can save a lot. And this is what we are trying to advocate for the technology-based peatland management in the region. So alhamdulillah, this project has been well recognized in the country, in Malaysia, as well as in the region. So we have our partners here in Brunei, Dr. Vida, as well as from Indonesia. And the project was selected as one of the regional finalists by USA and ASEAN. Okay, so the latest one was we presented this at the ITU, AI for Good, just a couple of weeks ago in Geneva. And then we have received a lot of input, especially from the deployment of AI, artificial intelligence for mitigating climate change as well as better managing the environment. Okay, some other promotion that we have made throughout the media. Yeah, this is on the publication, on the published media. So these are some of our scientific contribution in terms of publications in journal and conferences. We use machine learning, artificial intelligence, and big data analytics because once we have a lot of data from 2020 until now, so we have thousands, hundreds of thousands of data, so we can do big data analytics easily using machine learning. So here we publish it in this publication. You can get more information from here. And then we predict the groundwater level, and then we adapt it in the fire danger rating system, which is already being used in the region. So that's how we help the local community and the regulatory body, especially the meteorological department, by implementing the ground monitoring rather than, because initially they use satellite imagery. So we try to increase the accuracy by using this ground data. Okay, so some other work that we also use machine learning to help better predict the peatland forest fire. So we use this ANN, artificial neural network, considering 5 data from the weather station as well as from the ground sensors. Okay, so this is also another estimation of peatland forest fire in terms of groundwater level. And we increase the system by deploying the IoT and connect it to the water pump so that we can inundate the area with water once we have the alert of red risk code, means the highest risk code of forest fire. So these are some of the activities that we have throughout the project. It was then during the pandemic, so we couldn't travel. So instead we conducted online seminars. This was hosted by our partners in Indonesia, in IPB University, and also in Brunei by UTB, University Technology Brunei, also in Malaysia. So we have, it is a transdisciplinary project that we involve the technology developers, I am an engineer by profession, and we also have the forestry experts, the meteorologists, as well as the forest fire, the fire and rescue department. So you can see here in Indonesia, they share how they empower the community to help put off the fire whilst waiting for the fire and rescue department to arrive. And then this one is in Malaysia. This is the deployment of the IoT system in the forest, in the peatland forest. So this is where we collect the data from the ground and transmit it over the internet. Okay, so I think Peter has alerted me. Okay, so that's all for me. Thank you.
If there's any particular burning question, otherwise, like I said, we'll have a Q&A after the 3 speakers.
I have a burning question, given the fact that this is all about fires. That's very good too. Adewati, so clearly water is not a challenge if you flood the area as a prevention mechanism. Is that correct?
No, because it is a forest reserve. So they do have this canal enclosing the forest reserve because it is one of the ways they stop the forest fire from spreading. So they do have canals, and then the water pump is actually getting the water from the canals and pump and then redirect it to the area of potential forest
So
fire.
it doesn't cause water stress?
No, yeah. So it is nearby and accessible.
Okay.
Yeah.
Thank you. So let us move on to Kennedy from South Africa.
Hello everyone, it's very nice that you made the decision to come and join us for this session. We're very pleased to have you in the room. I'll start with a story. Well, it's not really a story, it's a very short phrase, but it's something that really impressioned me and is a reason why I'm continuing to work in this field, which is addressing heat health threats among vulnerable groups. And particularly in this case study, I'm looking at primary healthcare settings in my country, South Africa, but I believe there's relevance to other low and middle income countries around the world. And I just need to know how to, oh, there we go. So the phrase that I heard that will stick with me forever was, "The heat killed my baby." A mum said this when she arrived at a clinic in Burkina Faso, distraught, distressed, and in disbelief. Now, I think we're all familiar about global warming and the devastating impacts that it is having on our lives. In this case study, I'll tell the story of why and how we pursued tackling heat exposure in healthcare settings, and we did this particularly in a rural, vulnerable community. So we usually start thinking, I'll just go back because I want to mention this first, these are clippings from the media in South Africa talking to what we think is the anecdotal evidence telling us that there are heat health impacts. And why we have to focus on this is that if we wanted to say, look at data on ICD-10 codes, the ICD-10 code exposure to excessive natural heat, hypothermia, X30, is really reported and used on death certificates, at least in my own country. It's less than 10 cases a year, which seems really unlikely. There's a number of reasons why I don't think it's being used. But as I said, this anecdotal evidence is suggesting to us that it is underreported. And because we have increasing heat waves, accompanied by hospital admissions, the example on the far right was at the beginning of 2023, 7 farm workers working on a table grape farm in the Northern Cape province of South Africa rushed to hospital. Majority of them passed away. So the work that we've done to try and assess what does this heat look like into the future, heat waves and hot days are projected to increase into the future. And this is from most climate models around the world. In collaboration with CSIRO in Australia, we did this work some years ago. What we were looking at is the change in number of hot days. And in this case, it's hot days defined above 27 degrees Celsius. But it's not temperature, it's a combination of temperature and relative humidity, which gives you the feeling of real feel. And we know that these have impacts on health symptoms and heat health outcomes. And so here we're looking at the number of days with apparent temperature greater than 27 degrees Celsius. And it's about change. So starting off on the top right, top left, this is compared to the historical past, so 1961 to 1990. And the blue is just saying that there were on average around about 90 days in Southern Africa where temperatures, in a year, where temperatures were greater than 27 degrees, which makes sense. That's sort of like the 3 months around summertime. The crazy part is if we look down here in the projected scenario between 2071 and 2100, we can see where I live, which is just near Johannesburg, it's in the red, and that's saying that there'll be between 81 and 296 days in a year where the temperatures will be, current temperatures will be greater than 27 degrees. It's rather alarming. Women, infants, and children are often vulnerable to these heat health impacts and hot wave events. Following their Road to Health card, mothers bring their babies to primary healthcare facilities for checkups, vaccinations, and care when these children are ill. Queues are long. Waiting rooms are full and poorly ventilated. And despite the heat indoors, it is a tradition where mothers will swaddle or cover their babies in blankets, regardless of the temperature. And they sit side by side, and the room temperature increases. One of our first steps in this particular work to try and understand the situation towards informing decision-making and research opportunities and obligations almost, was to visit 8 rural clinics in the province of Limpopo, which is very close to the Kruger National Park and Mozambique. And we visited these clinics where mothers visit regularly. We talked about heat with the nursing staff and managers, as well as the visitors, the mums, and we measured temperature in the waiting rooms of these clinics for 1 year to cover all 4 seasons. And the next slide illustrates the temperatures that we found. So again, this is apparent temperature. It's a combination of temperature and relative humidity in a calculation. If you do it outdoors, you include wind speed. If you do it indoors, you make the wind speed 0. And the red stripes, I'll explain in a moment. These are set to threshold values, which explain to us potential health risks. But as you can see, majority of the temperatures, and I can't see the pointer for some, I'm pushing the wrong one. The majority of temperatures are sitting between around 27 and up to 40 degrees Celsius in the clinic. Some of them are slightly lower, hovering around 30 degrees Celsius in a waiting room where a baby is swaddled in blankets. You can see the drop-off from the December through to the early autumn. Of course, this is in the southern hemisphere, so the seasons are opposite to here. But majority of these plots are saying to us that temperatures are warmer during summer, cooling into the spring. A few of them are over 40 degrees Celsius. And these red lines I'll show you now are linked to these threshold categories. So remember I said before 27 degrees we used in the plotting of the projecting for those hot days. Now we can link them to the kinds of effects that we would expect to see on the human body. So between 27 and 32 degrees apparent temperature, fatigue, possible with prolonged exposure and physical activity. We were talking a little bit about the 40-degree mark, that's the danger zone, heat cramps or heat exhaustion, heat stroke possible with prolonged exposure and physical activity. So recognizing that these healthcare settings are not the only places, of course, where heat exposure like this is likely, we initiated work to develop a heat health vulnerability assessment tool using examples from around the world, including from Canada and the WHO, for small towns in South Africa. We realized that the metropolitan cities are doing a lot of work in this space, but the small towns, often with far less staff complement and resources, were struggling. So we worked with our district municipalities, our local municipality officers, NGOs, key stakeholders, and community members to understand the existing tools, and then we tried to set out to develop a similar tool for our towns in South Africa. We held several engagement exercises with councillors, with officials, the NGOs, and so on. And this was led by themselves. So we met before to explain the objective of this work, what we really wanted to try and draw out from them, but we did not lead it. We thought that the voices of those who were sort of in charge should be the people who are going to take ownership of the tool at the end, or whatever it was that we came up with. And it was really about trying to identify where heat was a problem in the town, and we used the local town of Rustenburg, which we had already identified based on our projections as one of the top 10 hottest towns in South Africa. So we knew heat was a problem. So we wanted to know where these stakeholders believed heat was a problem, and then we wanted to know how to intervene. So we used a 5-step approach, which is on the right-hand side of the screen, having community engagement throughout. We scoped We identified stakeholders. They helped us characterize heat exposure. We identified heat indicators. They identified adaptation options, and they identified interventions and actions to reduce the heat vulnerability. We identified and applied 8 indicators at the ward level. So within a local municipality, there are wards. It's the small level of management in the town of Rustenburg. The indicators were population, level of poverty, level of education, access to medical facilities, and that's especially around how long it takes someone to get to a medical facility. It doesn't seem feasible to ask somebody to walk 1 hour and 30 degrees Celsius to get to a clinic to collect their antiretroviral medication. Sanitation and basic services, access to public transport, if any, recreational community centres, as well as if any green spaces. We then populated these indicators with the help of our community teams using available reports. There's no point expecting community partners or local government officials to go onto big databases to try and download data and analyze the data. It has to be existing information that they can pull out. In the case of South Africa, we have integrated development plans every 5 years. The government tasks with specialists work together to document the current status quo in that area using existing information. And we said, let's use that information updated every 5 years to try and first develop and then monitor using this tool. We wanted it to be easy access and easily understood for decision makers to be able to do it again and elsewhere. The indicators were then summed in a very simple way with no weighting and presented with traffic light colors. In other words, red for high risk for heat, medium high risks, orange, and low risk. No, I've got it the other way around. You know what I mean. Red, yellow, red, orange, and green. And we had 3 wards identified as red, 28 as amber, medium high, and 6 as low risk green. There we go, I got it right. This is a very, very busy slide. I don't expect you to read all of it, but our participants then came up with interventions and solutions for different settings. That was their decision. And just interestingly, because they identified this taxi rank scenario as a place of risk, I'm actually doing work with the World Bank in taxi ranks in South Africa. So our ultimate goal was policy level, at the policy level, was to support the development of our National Heat Health Action Guidelines with sets of to highlight settings, tools, and actions and interventions needed to prevent heat health impacts. And this report is available online. It did cite our temperature work. I helped write this report, so I made sure that it was in there. But this is the relationship that you need between a researcher and government to ensure that you can get your research to talk to these kinds of policy decisions. Lastly, we developed a whole lot of materials I'm almost done, which we sent to all of the healthcare facilities in South Africa. And these are also available online on my website. I think the fundamental lessons learned for me was that to be successful in this space, you need to have a positive attitude, you need strong commitment and political and administrative will. I also think that you need a champion. So this person is Bonona Makula, and she is the champion who really feels like something needs to change in national government. And I think she's driving it. And some of the challenges that we faced in this space is, of course, around funding. And we heard about that in the plenary this morning. And I'd just like to acknowledge all of my team and community members. Thank you.
Again, time for one heated question. Okay, one at the back.
We could talk later because I think the National Weather Service category is problematic. Because they are on, but they're not based on. And so they put people, there are people who are very high risk in the low risk.
Could be something really important to do. I think if we can consider advice and research, but that's a great thing.
Okay, thank you for that. Let us move on. you present Cynthia Awuni from Ghana. Just a little point, yeah, I think some common themes already emerging from here that were important to us as we developed this book of case studies: co-creation, multidisciplinarity, cross-disciplinarity, cross-sectoral. All these ideas, I think, are starting to come together, and I think you will also see that in the presentation from Cynthia.
Yeah. Good morning, good afternoon to you all. My name is Cynthia Azuchimana. I wear 3 hats. I'm a PhD student from the University of Ghana, a lecturer at the Tamale Technical University in Ghana, and also visiting student at Imperial College. And this project is a result of a project called Pathways to Reputable Healthy Cities. It's a collaboration of several universities to see how they could intervene in creating pathways to health in urban cities. So this research is on co-production methodologies to deliver city-level, flood-level resilience and reduce inequities in sub-Saharan Africa. So it's looking at the methodologies that can be used in that. And it's co-written with Dr. Ben Howard and other researchers in the project. So why flooding? Flooding is a very difficult environmental disaster that has bedeviled us these years because of climate change. And in the world, about 1.8 billion people are at risk of flooding, and about 170 million of whom live in extreme poverty, especially in sub-Saharan Africa and the lower and middle income countries. And we know it's only getting worse, especially for these vulnerable populations. So this is a small city in Ghana called Tamale, in the northern part of Ghana. It has a population of about 300,000 people with a growth rate of 3.6 per year. It's highly exposed to climate changes due to increasing urbanization, because that is the 3rd biggest city in Ghana, and so has a lot of services and resources that people within the villages want to take advantage of. It is also called a gateway to the northern Ghana and some of the Sahelian countries, Burkina Faso, Mali, Ouagadougou, and all those things. So then it has grown a lot of urbanization has taken place, population growth is increasing, and it's subject to what we call pluvial and flash flooding because of its soil nature. It's a very clay, it has a very clay soil nature, so then flooding, flash floods is a problem. Because of urbanization as well, there's greening. And so once the water comes, somebody said that, recently we went to a community, somebody said that roofing sheets do not absorb water. So new development has created that. Initially, these local houses were able, especially the thatched, absorb water. But now with the change in how they construct houses with roofs, the water comes and it has to go down and then it has to flow. So roofing sheets do not drink water. So because of this, there was a team made up of academia, government, community, traditional authorities that came together to identify certain challenges that Tamale faced: heat, food and nutrition, issues of climate change, and flooding was very apparent. And so this team of stakeholders from diverse walks of life, from partners from private sector, as you can see over there, came to talk about how this can be done. Methods use. Peter talked about co-creation, co-designing. And so the methodology that was used for this is called co-production, where these set of stakeholders come together, sit down, co-create, co-design, and co-analyze challenges within the system, so that there is what we call people are able to identify with the problem, people are able to participate effectively, people are able to own the problems and then the solutions, and is able to bring about change within the system. And so in starting or initiating the project, we started with semi-structured interviews, where this is actually a workshop that was organized where we started with the planning. What are the issues? What are the challenges? And it's made up of all the relevant stakeholders I initially mentioned. Also, going into the communities, identifying vulnerable communities, flood vulnerable communities, putting up water level sensors to see, kind of identify there's the frequency, duration of and intensity of the flooding, and trying to calculate what is the vulnerability index. Interviews also around expert stakeholders within government were also undertaken, and that's really brought out a lot of issues. Now, the actors that we realized that were involved in the flooding are made up of all these people: traditional authority chiefs, community, individuals, national management disaster organizations. So it's kind of like a hybrid governance system that was utilized in managing floods within Tamale. What are some of the drivers that was identified? It was observed that there are both attitudinal and structural challenges. Attitudinal in terms of waste disposal, people dispose waste indiscriminately into gutters, it gets choked, and that is a problem. Structurally, the drains are not well constructed in terms of the quality of drains, in terms of the weight, what is it? What is it called? In terms of the width, because then if we have a better width, it's able to carry water, but if the width is not able to carry, then it overflows and goes into communities. And also you realize that in this picture, the drain has been constructed and left in the community. So when the water comes, then it overflows. So it also talks about improper planning. Government giving permits to people to build on waterways has really caused and created a lot of health hazards, flood hazards within Tamale. So the impacts. So when there's flood, primarily people get drowned, houses get damaged. In the initial, some flood picture I showed, you see the local houses with the thatch roof and then the, sandcrete structure. It easily melts, and then the community call it water sugar. So once there's a lot of water in the community and there's a lot of rain, it melts. The house just collapses and it melts. And so there's a lot of panic in the community. So damaging of houses, damaging of roads and bridges. Secondary impacts, disruption of services, hospitals, and that can also create health hazards. Once water and also water services, once the lines are being destroyed, then pathogens are able to contaminate the water, and there's diarrhea, cholera, dysentery that causes diseases. Then tertiarily, people lose their businesses. People basically lose everything and they have to start all over again. Long-term health effects. Recently, we went to the community, they are always afraid. When it rains, they're always afraid because they don't know what will happen to them. So then once people keep on adapting and then trying to mitigate, then the cycle of poverty increases. So in terms of adaptation, communities and governments have adopted levels of adaptation at the individual, household, community, and city level. At the individual level, people are able to do the basic things using sandbags to protect their houses, planting of some trees around the houses to support flood mitigation. At the community level, the National Disaster Management Organization creates awareness for people as to what to do when floods are coming and when the rains come. And at the community level, there are some evacuation routes, especially classrooms, mosques that they put up so that when floods come, people are able to run there to save their lives. At the city level, there are elements of early warning systems that are not even available at the community level because you need internet and all those things to be able to access them. What are the benefits? So with this project, it was very important, and then we already see results where communities said that, oh, if we hadn't come to this community, we wouldn't have gotten more information. We were ignorant about the fact that we could, do this and this to support ourselves in mitigating flooding. We could put things higher. We could plant some trees, So it has brought about knowledge into the communities. Researchers have also been able to understand some dynamics that they are able to help. Funders and investors could also support in mitigating and supporting communities to become more adaptable to flooding. And traditional authorities have become more happy and then supportive of the process because they know that within their communities, if they are not able to support, then the flood issues becomes very challenging. Lessons learned, inclusivity. So for us, co-production creates inclusivity. It includes everybody within the system. It includes government, it includes local community chiefs, researchers that come together to be able to find a solution. So that is about the co-creation, that is about the co-design of issues. Dissemination. It's also observed that once it's created together, dissemination is easy. Because communities have accepted it, and then communities are able to also inform other people to be able to also adapt to better ways of flooding. Trust building. Also, the fact that once I am in the process, I know all the nitty-gritties within the system. So I trust the process. And so it builds trust and it builds support within the system. Also, in terms of impact inequality, we realize that flooding impacts people differently, the rich and then the poor. And so it's important that once co-production supports this process, it's important that we identify which people are most vulnerable. So they are given more of the support. And so then there's appreciation of the process. Based on this project, these are some of the projects that have come out of it. And we are hoping, we are actually doing some work now at the community level to support in flood mitigation. Thank you very much. Impagia in the local language, that is what it means.
Thank you, Cynthia. Again, one quick question.
Thank you, Cynthia, for a very interesting presentation. So I come from Limpopo in South Africa, where Karadi did a lot of her research. And the area where I'm from, we have the same problem where we have the two governance systems. We've got the government, but then also the local government, and there are pockets of tribal areas, pockets of regulated areas, and the dumping of waste, burning of waste. It is really a big issue. So I've been trying to get government and traditional leadership around the table so we can talk and work together, and I'm really struggling. So, how did you guys approach that? Because, to avoid the finger pointing that happens, and did you engage them together separately?
Yeah, so what happened was that we called for a workshop and invited all the parties. to a table, and then we sat down and then discussed what are the issues. And so flooding came up as an issue. So once you invite them, they come. You know, once it's a workshop, it's an open space, and then a facilitation is done where both systems see the need for interventions. Once that is done, then they are able to cooperate together. So then there is both a matter of meeting them together and also meeting them separately to look at specific issues that are related to them and how they can intervene. So that is how but also, as I said, trust is important. Personal networks are very, very important. If you have some networks in government, you're able to discuss with them initially the issues, and then once you get buy-in, then the support comes. Yeah, so that is how, and also at the community level, you know, the elders and the chiefs require respect. So a proper community entry is important. When you go to a community, who is in charge of this community? So going to see them and acknowledging the fact that you've come there to support also helps them to give you their trust. And then once that is done, then you see, because they realize that you are not coming to watch on them, you've made it transparent, so they're able to now give you their attention. So that is what we've been doing. We make sure that anytime we go to a community, we go to the leaders of the community, we talk to them what we are about, and then they give us the support. When we started, we actually went to the biggest chief in the area and said, okay, we have come as researchers. This is what we are doing to support the growth of the. Once they are aware and are informed about your intentions, then they are able to give you the support. Yes, thank you.
Okay. Thank you, Cynthia. I would invite you actually to take a seat up here with Parody and Webby. Maybe I hope you can hear us if Montira and I sit in the front row. We have a couple of overarching questions, and then we'll open the floor up to all of you.
Let me sit on the sides because the light is really bright.
Yeah, so maybe
Do you still need them?
turn the slide off.
Yeah. Thank you. Thank you, speakers. Really wonderful session. I think we know there are barriers to mobilizing scientific evidence and findings for policy action. So based on your case study experiences, what do you think are the next critical steps for using scientific findings for existing policy processes right now? I know you work at different levels, but based on your case study experiences that you presented here, what do you think are those opportunities for next steps right now?
So for right now, I think that one of the critical things as researchers, and I believe we're not all researchers in the room, but I'm a researcher, is that the luxury, which I think is just a luxury, or maybe it's another word, of just publishing, going into a community, doing work, and just publishing a journal article and thinking you're done is gone. That's not the way we can do research anymore. It is much more effort and time consuming. It can also have psychological impacts on you when you feel like you're not making a difference with your research, but you have to go beyond just getting funding, doing a project, writing it up, and it's done. Especially if you're working in communities which I mean, I think a lot of us are. That's where we want to make a difference in this space. So in the case of my work with the National Department of Health and the National Department of Forestry, Fisheries and Environment, we all sit together regularly. We meet regularly, quarterly actually, including researchers and NGOs and private sector like power companies in the case of air quality and climate change, and discuss the issues and what needs to be done. And then I did also mention that I actually co-wrote the National Heat Health Action Guidelines. It wasn't just written by a government official. So we could ensure that we were informing the work that was, and the advice that was being put into that report. And so for me, the biggest thing as a researcher is we have to make sure that we get out of our offices and try and make more of a difference with our research.
So I want to add up to what she said. I remember when we were collecting data, we went to one community and then they asked us, I hope you guys are not coming to collect data like the others and go, and they don't even bring it back to the community to tell us what it's about. So extraction of information from community and then that ends it. I think we have to go beyond that. And that actually pushed us to develop a project, and now we are implementing it in the communities on titled Enabling Flood Adaptation. Last week I was in Ghana, and then we went to the community to start the project, where we try to work with them to come out with workable adaptation strategies. And so it's important that we leave something at the community, not just for our own benefit as researchers. We do it, we get the articles, we get our promotion, and then it's done. No, I think we have the greatest responsibility to ensure that what we find ways of resolving their challenges for them, because they are vulnerable and they need support.
Thank you. I'd like to echo that sentiment as well. In our project, I remember when we started in 2018, and then when we start to meet the local communities and explain to them this technology, IoT, big data analytics, and you can imagine the villagers, they were like, what is she talking about? And then they feel like we are replacing them. You know how technology, they think that because they've been taking the measurement manually all this while. And then suddenly we say that the technology can help them to monitor them just on a mobile phone. So they were like very reluctant then in 2018. And then we have to ensure that we still need you to come and validate the data. We will teach you, we will empower you. And then, you know, it takes years for us to engage with the local community. And then we talk to their head of villagers. And then we mentioned to them that, okay, this is what we have done. So you can see it in your mobile phone, and you can still go there in person and see the deployment of the sensor there. It's not another sensor that we are taking and not informing them what we are taking. So in our case, the point of contact is always the forestry department. So we try to give trainings to the forest rangers. We make sure that they understood the technology and what we are doing. And then they are the ones who talk to the villagers. So we go there from time to time. But UPM, where I'm working, is like 2 hours away. So the local community is the one that we need to empower. So we did that through the forest rangers, which are located there in person. So I think that's the most important thing that at least me and my project members need to do, is to gain trust with the regulatory body, with the local government, and especially with the local communities.
I have to add something though, because I think there's a very big disconnect in something now, is that we want to do this more meaningful work. It takes longer, it's much more complicated, and a project is finite with finite amount of funding or resources. And so in work I'm trying to do at the moment with the NIH is look at the effectiveness of adaptation interventions. And I want to be able to say that we should be considering impact beyond the short term of the project, but who's going to pay for that? Now, I can't go to the European Union, you know, we've got some Horizon Europe funding, and say, well, okay, our project is 5 years, but actually we're hoping that there'd be benefit in 7 years. You know, obviously we're hoping for within 5 years, but we think it'll really only roll out in 7 years. Are you prepared to pay another 2 years worth of funding so that we can check for that impact and maintain the sustainability of the whatever the adaptation is? And as funders and donors, I don't think people are, or we're not in the space yet where people are going to realize that's actually what we need. So we've got a lot of work to do to try and connect all these different things together.
Really important point on sustainability, and you all mentioned lessons learned. So incorporating those lessons learned into long-term capacity building I think it's key, but as you
Yeah.
know,
Mm.
not very donor focused.
No.
So we can come back to that
Yeah.
in a bit. Yeah, you had another question?
Well, before I move to the next question, we talk a lot in international science. I hope everyone can hear about parachute science, especially the richer laboratories in the north going into developing countries and taking the data. But it's interesting to see that also on a within country level, and that you're very aware to avoid that happening, and you're working on that. I was going to jump to another question about scaling up or replicating the actions that you've done. Maybe Cynthia, you work very much in Tamale, one particular city, but I imagine there are other cities in Ghana that have very, very similar problems. And have you considered how you can take what you've learned from Tamale and help other cities as well?
Yeah, so in actual fact, there's a small project also ongoing in Accra. That's the biggest city, the capital city of Ghana, where they also have a lot of flooding. There's a lot of research on it. Because it's coastal town and the population growth is over the roof. So even this, we are in the rainy season now, and so they've had already a number of floods. So we are also intervening in that city. When one of my colleagues came in, we did some work, as I said, in Ghana. We brought along flood sensors that are going to be installed within that community to also see measure the intensity, the duration, and all that, to see how they could also those challenges would be identified and the interventions done. So we're actually looking at other communities. And basically what we've done in Tamale could easily be replicated in all communities and towns that have issues of flooding. But then the issue is also about the cost. That's Caribbean mentioned. How much and to what extent can we go in supporting these communities? So it's important that we're able to target strategies that the communities themselves can do. Even if there's no much resources, what can they effectively do to support themselves to be able to mitigate? I believe if we go that dimension, it will really help a lot.
Yeah, so, there's a gentleman behind you.
Just in this direction. So my name is Michel Spiro, a member of the Earth Humanity Coalition. To go in this direction, just funding projects is not enough, because, as you said, the project are for 3 years or 4 years. So what is at stake is building an economy, a sustainable economy of resilience, matching the need of the local people in the territories. So the impact of what you are doing would be ideal if at the end of your project you have created a local economy with a private sector, entrepreneur, having the spirit of resilience in this territory. Please.
Yeah, so I was going to add on that it's very difficult to do that, get the whole thing to move on its own before you leave, to ensure that it's sustainable. It does happen. It's not in the instance where people just go and dump technology and expect it's going to work, like put solar panel geysers on people's houses where it's a shack and the roof actually can't even hold up the geyser, and it leaks. You know, that is totally maladaptation at its worst. But I think it's also around creativity and mindset change. So as researchers, we have to use opportunities. And so, for example, I mentioned earlier in my presentation that in Rustenburg, the minibus taxi industry. So in many African countries, the informal sector of transport are in like 16-seater buses. It's a very well coordinated industry, but it's technically informal. And in South Africa, I think about 500,000, if not more, people use it every single day, twice a day, as a regular form of commuting. And those taxis are full, they're overfull. They actually add in an extra row of seating. They're very, very hot. So I was able to get a little bit of funding. It's actually a bit embarrassing, but I'll tell you the story quickly. I was able to get a little bit of funding. We interviewed drivers and commuters of these taxis, 300 of them. We heard about all the problems that they face and the things that we could do about it. I had co-created this project with the local mayor's office, as well as the body overseeing the taxi industry. And when we came back to them saying, this is what your drivers and commuters are saying, that they would really like more trees and more shade protection and water available to them so that they could drink water to stay hydrated. And I said, well, based on my funding, I can give you 2 mature trees. And they laughed at me. Of course they would laugh at me, because that's ridiculous. What is 2 trees going to do in an enormous taxi rank serving 300,000 people on a daily basis? Nothing. But I was able, so they then suggested we do an awareness campaign, which is what we then did. But I was then able to secure funding from the World Bank, because I've now got some original data to show that there's a problem, that the community themselves is very engaged and wanting to understand more. And the World Bank is initiating a huge project on climate change and health at the moment. And they are now funding. They've just funded a feasibility study to assess temperature in minibus taxis and in ranks. And they're now going to fund a multi-country project on something on a wider scale. So it is a little bit about being creative with how we approach our funding and opportunities to get the data we need to get bigger and scale up, Peter, as you were saying.
Thank you, Peter. So when we talk about replicating the project to another area, like we have done this in Malaysia, Indonesia, and Brunei, our project. But say if we want to have the technology here in Finland, of course, probably there's no payment for us here. But if we can engage with what is the potential forest fire here in the region, and if we can engage with the subject matter experts, especially on the soil properties, and we know the soil properties in one area is totally different from another. And even in ASEAN region, Malaysia, Brunei, and Indonesia, we call it as Finland forest, but the soil properties is totally different. And we have to liaise with our regulatory body and the forestry department to get approval, as well as to get information on the deployment of the system. So I think it's feasible to do it, to scale up, and also to extend it and replicate it in other areas. And then talking about funding just now, when our project ended in 2022, and then we were waiting for the next kind of funding. You have no idea how many proposals we have sent out. And then I was thinking, like, oh my goodness, how is it so impossible to get funding right from our own government? So I say that maybe this is the time for me to get into international platforms. So we were lucky that we attended the IAP session and Save the Children in Trieste. And then I see that when we engage with policymakers, and that it is a top-down approach, that we deal with the policymakers themselves, and then they see the needs of this solution, of this science-based policymaking and decision. So this is what we are trying to do, and to further sustain the project. I think it's not like one solution fits all. We have to engage with the community, we have to engage with the state government, the local government, and then, of course, the funding, the quantum probably is not enough to cover everything that we wish, the wish list that we have. But at least for me, it is time to get creative on how we can further extend the project. So sometimes it's just not the funding that is the obstacle, but how we engage with the community. So perhaps when there is no objective that we have to comply with the funding body, then we can, like what we're currently doing now, we just approach the community and tell us what are the things that you need from us, the researchers as well as the policymakers.
There's a question in the audience.
Okay, we're just going to open it up to the floor now. So, and also feel free to put Montira Ray on the spot, but the stars of the show are the 3 ladies here. So with you.
Thank you so much for the presentations. My name is Daniel Yanganira. I'm from the Urbanization Center. I'm interested in the presentation that we made, but I want to come to the last presenter's comment. I'm missing the involvement of national governments in these projects. And then for sustainability, we need that. Because it's good that we depend on donor communities, but it's important for our local governments to know what we are doing with the data. For example, I saw the drainage infrastructure that has got not complete because the lower part is still on soil, so erosion can still happen, and also the heat wave in the communities. Can the government come in and build really good infrastructure which is well conditioned? What do we do? How do we present the information we've got from this project to national governments?
I can answer that immediately. So the lady in my presentation at the very end, wearing the very colourful jacket, is the National Air Quality and Climate Change Officer. So she's on my team, and she was involved in the project from the very beginning. And that's how we ended up with the National Heat Action Guidelines. But in terms of structural and infrastructural changes, that's what we were speaking about earlier, the colleague behind me, is that we really need this interdepartmental, sectoral communication. So we've got really good connections in our country between the Department of Environment and the Department of Health in terms of climate change and health. But we know that that's not the solution. We need a much more multi-systemic approach, but that requires someone from sanitation, someone from waterworks, everyone at the same table, and that mindset doesn't exist yet. We haven't quite got there, I don't think, and they don't. It's not a priority. Africa, the Agenda 2063, the Africa we want, according to the African Union, is a development trajectory. So how do we ensure that climate change is brought into that development trajectory at the same time as them pressing forward? And what Cynthia showed and what I showed in the clinics is that there are certain areas that are prioritized over others in terms of infrastructure development. And at the moment, it's in urban areas, particularly like deep urban areas, rather than rural areas. I think they are really the vulnerable communities being left behind.
Yeah, and actually there's involvement of government. If you look at the team, we see the physical planning officer, and then the mayor was there as part of the process, because you cannot go into an area and intervene without involving the government. It will not work, because somehow the government is responsible. Even at the community level, we have government officials, the assembly we call them the assemblymen. That's interface between community and government. So at all those levels, there's government involved. And also with what we have done, the idea is that we have a discussion with government on what we have, the research, and then as they are informed, they're able to include it in policy development for their next phase of planning. So actually, we are very much in touch with government. Otherwise, it's not going to work. The drains like this, it cannot be done without government. So the Hydrological Services Department, the Tamale Metropolitan Assembly, the Urban Roads, department, they are all part of the process. Yes.
Yeah. You want to do that or not? So I think the same issues that we're facing in my country, Malaysia as well. I remember when we started in 2018, and then we tried to engage with the forestry department, and then they were very reluctant because they feel like when we are deploying technology and it will be observing that without any human intervention, they feel defensive because it feels like we are exposing their weakness, that they are not doing their job, and then the forest is on fire. Well, actually, it's not necessarily their fault. And then we keep on engaging with them, no matter how much they push us away, and then we keep crawling back, because we think that when we are advocating and engaging with them, they will open up in a way. So since 2018 until now, 2024, we get their people to come into the project. So we invite them to be a project member from the forestry department, from the meteorological department, from the fire and rescue department, and then they see the benefit, they start seeing the benefit over the years. And when they were approached by other technology developers, and then they start to open up. So I think that's the beauty of it, that we start engaging them and build the trust and relationship, and it will come as top down rather than we researchers approach them and then they reject us.
Another question here.
Hi, so I work in the disease modeling, climate sensitive disease modeling space at University of Cape Town. My question to you is, to all of you really is, I think what we can clearly hear is co-creation in each of the projects that I implement. And one of the challenges as I think we experience across research projects, as you mentioned, is the monitoring and evaluation components afterwards and ensuring implementation after the end of the project. I wonder if you have to think perhaps a little more creatively when considering the funding model itself, because most of our research is not domestically funded. And how sustainable is that funding model? Should we be trying to do something like build into our applications a component, since co-creation is part of it, the co-application where there's a little bit of co-financing beyond the end of so the research project is a 3-year project from this global funder, and then there's something like a 2 or 3 year, a much smaller co-financed component, either from government or from some other entity, but would be international donor as well. That could be perhaps something the donors, I think sometimes the donors, they don't even consider these options. We just apply for the limits that a donor prescribes and we leave it at that. But sometimes engaging in these conversations, in my space, I found that to be a little useful. But the other thing that I feel we don't leverage enough is the private sector. And if we look at the corporate social responsibility taxes that private sector needs to pay in all of the applications discussed today, whether it be flooding or heat, there are various industries who directly benefit from adaptation, and so I wonder whether we could leverage the taxes that the private sector pay in order to do this type of monitoring evaluation, in order to help us, with the sustainability sort of aspects after our research projects.
Interesting propositions. Maybe I can ask you to keep your answer short.
Yeah, no, I can answer quickly.
I see other questions coming.
Yeah, no, I can answer quickly in saying that I think, again, this is asking researchers to be creative. You're going to have to be very creative. It also means that we have to go beyond just writing a funding application to the Wellcome Trust and hoping that we get it. We need to take on, when Wellcome Trust says to you, would you please be a technical advisor to us, to suggest, what's going on in the space of climate change and health, what are the challenges, what can we do to potentially help? We take up that call unfunded and advise them for 2 years, given our experiences around exactly that. Can we change funding models? Can we co-fund things? Because often an application says, if you've got other funding, we don't want to fund you. And that's not necessarily how we need it to work. So I think, again, this is a big call for funders to engage with donors, researchers to engage with donors and funders, and not just in an application, but in a conversation.
I agree with you. In ASEAN region, transboundary haze is a very sensitive issue. Starts pointing fingers, who started the fire first, spreads to another country, and so on. And then if we can engage with the companies and the industry, especially in our region, the palm oil plantation, they are big in the region. So it starts to come in. It's not like here in the first world country. In our developing country, they start trickling in when they have to comply with regulations for palm oil export. So they have to comply with all the sustainability aspects, and they have to monitor the activities, especially the slash and burn agricultural activities. If they can, comply and monitor it more effectively using the technology. So we start seeing this in the coming years. And then especially in our country, the palm oil plantation like Sandabi, Felda, and etc. So sometimes the monster or the big guy is the one that is they are not aware, but they don't see it in terms of their returns. So once we show them the ROI, if you don't do this, you can be fined, which is so much percent over what you are invested in this. So this is what we're doing right now. I think this is a really good idea.
Yeah, my question is maybe a little bit more specific, but I noticed in Charity's presentation that there was one key individual, right, which is called a champion, that sort of drove the process forward. And I don't know if there was a similar individual in the other cases, but I'm interested because in the work I'm doing, based in Montreal in Canada, it's looking at the collaborative implementation of a policy to enhance urban agriculture at a very, very local level, so at a neighborhood level. And I also found that this one champion, and I truthfully, things would have been very different without this person. And so my question is, I mean, obviously, how do you make a champion? I think they're all around us. And I wonder if there are certain conditions that I'd like to get your insights on whether there's certain conditions that can sort of promote their emergence, of like coming along and actually becoming part of this change process or whatever the project is. And also, I'd be interested to know, Charity, how you think the outcome might have been different had this person not been.
Yeah, and that's such a tough question, isn't it? And it is sometimes finding like a diamond in the rough. When you do find that individual, you nurture that relationship. So life is all about relationships for me. That's how I live, the principle of living. And in this instance, I could see that this individual was raring to go, but was needed capacity strengthening. So I offered to do one-on-one mentorship in terms of getting to understand the content, the theory, the sort of science space, at least. Of course, she's completely skilled and experienced in everything to do with governance. And actually, she was a medical doctor. So, that sort of thing makes all the difference in the world. And I again think that it comes down to the mindset of the individual. And that she was really, really willing and still doing it today to drive things forward. And she's a doer. One of those people who really wants to get things done. I'm petrified if she leaves. I don't know what's going to happen then, although we are sort of grooming one person in her department so that we think we can, fill the gap if that had to happen. But the relationship building was key, inviting her to meetings, paying for her to attend meetings, to go with me overseas to events, to really get to understand the space. I think you could really make a difference by doing that. I don't know about your projects.
Yeah, I think it's similar. It depends on the project. So for the flood project, there are certain departments within the government that are kind of directly in charge. So for flooding, it's the National Disaster Management Organization. So we kind of targeted that organization and got somebody within the area that the project was being implemented to drive the process. So that person, so in any of the case, you need to get somebody who is, who has the interest, who is interested in change to drive the process. And also at the local level, getting somebody who, for instance, in the community, there's an assemblyman who has the mandate to ensure that development happens. So involving them is critical to the process. So it depends on the project. It could be one champion, could be a number of champions that could support the whole process. You get it? And then the challenges that, as she said, for instance, the assemblyman is elected. So what if the next election, it doesn't get the election? Because you've already told that you have to start all over again. So they are, the champions are there to support, but then we also have to look at sustainability. In case they are not there, what can also help the system to work? So that is why it's also good to work not only with one person, but maybe 2 or 3 people, that if one is not there, the other one can support until the system recreates itself. So it's quite dynamic in that sense.
You have to feel your way.
Exactly,
through the
yeah.
people and understand them, and succession planning.
It's very, very
Any last words on
Yeah.
this, and then we'll wrap up.
Right, yeah, it's true. We need champions like from multiple levels, from the regulatory level, from the local community. And then it is good that in our project, we have someone that lives there near the forestry, the forest reserve, and it is in the nearby village. So we empower them so that they can have a touch and feel of the technology, and then they know how they can deploy and help monitor the area that they live, the area that they are living in. And then if something happens from the forest reserve and spreads to their village, especially in terms of fire, of course, they will be really in a dangerous situation. So we have that one person, which is the local community head of village. And then this is where we engage with them, and then how we can collaborate with the local regulatory bodies.
Thank you. Well, please join me in thanking our speakers and panelists. I allow you to sit down. Wanted to take 1 minute to sort of wrap up. I think we've gone over time a little bit. To emphasize again, the 3 case studies that you've heard today are included in this book. Copies are here. It's also online. You can download chapter by chapter if you don't want to carry anything. Not too heavy. It suitcase easily. And some of the sort of overarching sort of thinking behind it, and what's the sort of synthesis that we produced are all on offer. Again, it's online, this infographic available to take away. That you can't argue about carrying. It's not so heavy. And I just maybe pass that last word to Montira. Any final thoughts from your side?
Thank you, Peter. It's been a great pleasure to work with these 3 speakers and Peter and the academies as well. So I think you've heard very clearly and very loudly that science and technology do not stand on their own. So there's a lot of engagement that's involved. The process is very important. So how we do science must change. It really matters how you design a research question, how you execute implementing the methodology for answering that question. And so I think we can think differently about science, how we shape it and how we carry it out. So I hope you take that away from this session, and hope you learn from the case studies that we have in this book. That was a great pleasure to produce with all of you, Peter particularly. So thank you. I hope we get to interact in the sessions and through this week. Thank you very much for coming and all of your great insights and questions.